I chose alcohol use disorder because there are multiple people in my family who struggle with this. I know by personal experience how it can affect the family and those around. Before this project, what I didn't really understand are the ins and outs of the disease. I wanted to get a better overall idea of the disease. In this presentation, I aim to help educate on the disease, and I want to help people understand what it's like to have alcohol use disorder and how it affects those around them. I also want to help teach on how to overcome it. Alcohol use disorder. The biggest thing to understand is that alcohol use disorder is a disease and that the addiction does not happen by choice. That is, no one chooses to be addicted. It's a chronic, relapsing brain disease. It is estimated that 16 million people have alcohol use disorder. 6.2% of adults were diagnosed in 2015. A notable 623,000 adolescents were also diagnosed. The number of men with the disease is almost twice as high as the number of women. Depending on which of the symptoms one has, it affects people differently. It causes a strain on relationships and makes it difficult to maintain a job. It heightens the risk. Hold, please. It heightens the risk of other diseases. It causes strain on their relationships for multiple reasons. The person suffering may put alcohol before everyone else, meaning they put the alcohol before other people's time and their safety. It also becomes difficult when a family member is trying to help but may not have enough information or be able to convince the family member that they need help. It affects their job because they put alcohol over all other responsibilities. To be diagnosed, one must show 2 or more of the following within a 12-month period: drinking more for a longer period than intended, continually wanting but being unsuccessful in cutting down or quitting drinking, spending excessive time getting alcohol, drinking alcohol, and suffering the consequences, having a strong desire or urge to drink, failing to fulfill major responsibilities due to the drinking, continuing to drink even though it has caused relationship troubles, prioritizing drinking by cutting back on other activities, drinking in situations where it is physically dangerous, needing more alcohol than was once needed to feel the same effect, having withdrawal symptoms. With this in mind, there are many different levels of severity depending on how many of these symptoms one has. History of treatment. In the 1750s, North American tribes used healing rituals for alcohol addiction. In the 1800s, short-term housing opened for those looking to detox. In 1864, the first alcohol rehabilitation center opened. In the 1880s, Freud recommended cocaine to treat alcoholism. In 1906, the Emmanuel Clinic opened a church-based psychotherapy unit for AUD. AA was formed in 1935. In 1948 to 1950, medications were created which did not react well with alcohol, thus lessening the want for consumption. In 1958, Halfway House was created. In 1994, a new drug was used to treat AUD. The effectiveness of current treatments. Abstinence. Though there is a risk of relapse, as long as someone is abstinent, they are not drinking, though this may result in negative withdrawal symptoms. Harm reduction approach. Similar to medication, this is not a cure, rather a way to manage and lessen the amount of alcohol consumed. Rehabilitation. Patient rehab is very successful, but outpatient rehab comes with a risk because they are not under constant care and can relapse whenever they are alone. Medication. Medication does not cure this disorder. Rather, it helps manage it and lessen the amount consumed. AA. A study conducted by AA in 2014 shows that 27% of the more than 6,000 members who participated in the study were sober for less than a year. In addition, 24% of the participants were sober 1 to 5 years, while 13% were sober 5 to 10 years. 14% of the participants were sober 10 to 20 years, and 22% were sober for 20 or more years. Prognosis. Treatment works for many people, but because it is a chronic condition, the success of these treatments vary. Some will stop drinking altogether, some will suffer relapses. Those who are not treated tend to develop other health issues that put them at a higher risk for deadly situations. Studies show that the longer one abstains from alcohol, the more likely their sobriety will be maintained. Consequences when not treated properly. Liver damage, reduced testosterone levels in males, memory loss, confusion, work or home life issues, a coma, heart problems, diabetes, thinning bones, cancer, and suicide. Additional information. Studies suggest that those who begin drinking earlier than 15 are more likely to develop alcohol-related issues later in life. Alcohol abuse can run in families. In fact, the rate is 3 to 4 times higher in close relatives of alcoholics. The Sinclair Method. In Finland, there is a researcher who claims an 80% cure rate for AUD. This method requires you to take medication before drinking that has adverse effects with alcohol. Though it has a high success rate in Finland, it is not caught on in the U.S., mostly because it encourages people with AUD to keep drinking as to feel the side effects. Additional resources. Some other websites that can give you additional information on alcohol use disorder are the National Institute on Alcohol Abuse and Alcoholism, Mayo Clinic, and American Addiction Centers, which are all linked in this presentation. In conclusion, AUD is a chronic, relapsing brain disease. It affects 6.2% of adults and 623,000 adolescents. It affects one's responsibilities and relationships. The best course of treatment is abstinence. Many negative health and personal effects occur when it goes untreated. I hope this helped educate you further on alcohol use disorder.